Okay, we have a 60-year-old male sitting here describing to us that he has symptoms including right-sided weakness as well as slurred speech. He describes that his symptoms began approximately 6 hours ago after being involved in a physical alteration the night before. So we're going to begin by introducing ourselves to our patient. Hi sir, my name is Harrison. I'm a paramedic. I understand that you were involved in a fight last night and you're having some right-sided weakness as well as some slurring of the speech.
Yes.
Okay, we're going to do a couple assessments just to see how severe it is, okay? We're probably going to go to the hospital tonight, but let's figure out what's going on, okay?
Okay.
So the first thing I want you to do is I want you to close your eyes, and I'm going to guide your hands up, and I want you, when I let go, I want you to just hold them still, okay?
Okay.
Okay, ready? Just hold them there, hold them there, hold them there. Okay, we see that our patient has some right arm drift, which gives us a LAM score point of 1. So this is a sign that there could be some form of ischemia that is occurring and causing damage to the brain that is affecting his motor control and his muscle tone. All right, sir, so the next test we're going to do is I'm going to take your hands again and I'm going to have you give my fingers a squeeze, okay?
Okay.
All right, go ahead and squeeze my fingers. Awesome, perfect, thank you. So after having our patient conduct the grip strength test, we've noticed that he's also having some right-sided grip strength weakness. And so this is sort of another point to our LAM score that's going to hint that our patient is experiencing stroke signs, potentially due to some form of damage occurring in his brain. Okay, and the last one I need, we're going to do this twice, but I need you to give me a big smile, okay? Perfect. We're not seeing any facial droop or inequality to our patient's smile, which gives us a LAM score of 0 for the facial droop, which gives us a total LAM score of 2 points. This tells us that our patient might likely not be experiencing a stroke, but is definitely exhibiting with some symptoms that could be a result from some form of brain injury. Okay, so perfect. Thanks for that. We're going to move on to assessing your cranial nerves. You have 12 that are all wrapped around in your head that are involved in maintaining just every day-to-day life. So we're going to be assessing them 1 point at a time. Do you understand?
Yes.
I'll be walking you through this the whole time. But I want you to know that you can refuse at any point you'd like. Okay?
Okay.
Okay. Let's begin. I forgot an alcohol swab, but I saw that you have some open booze bottles, so I've gone ahead and I've poured a shot of a mystery drink, and I want you to tell me what it is, okay?
That's alcohol.
That is alcohol, absolutely. So what we just did there is we just assessed for your olfactory nerve. This is the nerve that is responsible for your sense of smell. And so we want to make sure that it's intact. Otherwise, you would probably be smelling something other than alcohol when it's clearly alcohol that I've poured, okay?
Right.
Excellent. So our next test is going to be assessing your optic nerve. And what I need from you is I need you to focus on my nose. And I'm going to be shining my pen light in your eyes twice on each side, okay?
Okay.
What we're looking for is we're looking for direct reflex as well as consensual reflex from the other eye. And we're looking for constriction when I shine the light in our patient's eye right here. Do you understand?
Yes.
Okay. So I'll just have you focus on my nose, okay?
Okay.
Perfect. So what we've noticed on our patient is that our patient is having left-sided sluggish pupils, which could be an indication that there is some damage that may have occurred to our optic nerve. So we're going to continue on with our cranial assessment. Okay, so the next thing is we're going to be testing 3 nerves in one. Okay, this is going to be your ocular motor, your trochlear nerve, as well as your abducent nerve. And so what all these 3 nerves do is they work together to control steady eye movement and coordinate your vision, okay? So we're just going to be assessing for that, okay?
All right.
What I need for you is I need you to focus on my finger here. Okay?
Yeah.
So we're going to begin assessing for pupil dilation as we approach his nose, and then constriction back again as we draw away. Now I need you to hold your head still and just follow with your eyes, okay?
Right.
Perfect. What this assesses is we're sort of taking a peek and looking at and focusing on observing our patient's eye movements, making sure that they move in a coordinated fashion with one another, as well as performs in a smooth, fluid motion. We're looking for any nystagmus, which could give us a bad finding. But we haven't noticed any with our patient, so we're going to move on again. What we're moving on to now is we're going to be working on the trigeminal nerve. Now this is actually 3 small nerves that are responsible for giving you sensation in the top, the middle, and the lower third of your head, okay?
Okay.
So what I'm going to be doing is I'm going to rub my finger on one side and then the other side and then both together at once, and you're going to tell me which one you feel more of, okay?
Okay.
Okay. Do you feel that?
Yes.
Do you feel that?
Yes.
Which side is equal?
The right side.
The right side? Okay. Okay, do you feel this?
Yes.
Do you feel that?
Yes.
Which side is equal?
Right.
Right. Okay. Now do you feel this? Do you feel that?
Yes.
Do you feel this?
Yes.
All right. Equal or preference?
Preference.
To which side?
Right.
Okay. So our patient is telling us that he's experiencing some right-sided preference or stronger sense of sensation on his right side, which could indicate to us that there is some damage that is occurring to the trigeminal nerve on the left side that is producing less of a sensory effect. Perfect. Okay, so the next one is we're going to be assessing for is we're going to be assessing the facial nerve. This is the nerve that is responsible for all the muscles in your face. So I need you to just give me a big brownie face. Let's see your eyebrows too. Perfect. We're assessing for equal muscle tone on both sides. It seems very well maintained and quite equal on both sides of his face. And so it tells me that doesn't seem like there's any traumatic damage to his facial nerve at this point. This is great. We're going to be moving on to our 8th cranial nerve. So I'm curious as we move forward. This is a testing for your acoustic nerve, which is responsible for your hearing. So, sir, I ask you, lately, have you experienced any change to your sense of hearing?
Yes. This morning I woke up with my ears ringing.
Your ears started ringing this morning when you woke up. Is that correct?
That's correct.
Have you been having any changes in balance or any dizziness lately?
Yes, I've been experiencing some dizziness
Yeah, and when did that start?
this morning.
Yeah, because you were attacked last night, and then you woke up this morning experiencing some dizziness, as well as some differences to your hearing.
Yes.
Okay, let's assess that. Okay, what I want you to do is I want you to just listen real good. I'm gonna rub my fingers together, and you're gonna tell me which finger fades away first, or if they both fade away equally and simultaneously. Okay.
Right. My left ear.
You've lost the left ear?
Yes.
Okay. So our patient is experiencing a difference in his hearing, which is mainly affected on his left side, which tells me that there could be some sort of damage that is affecting the left side nervation of the acoustic nerve. Perfect. So we're going to move on. I understand you've been having some slurred speech. So what I want you to do is I just want to take a look to see how well you can swallow. Good? Okay, and now I want you to say llama.
Llama.
Say that one more time.
Llama.
Our patient seems to be experiencing some slurring of his speech, especially when he makes those guttural sounds from the back of his throat, such as the word llama. What this tells us is there's some sort of damage that has occurred to either his glossopharyngeal nerve or his vagus nerve that is responsible for creating these guttural sounds from the back of the throat. Perfect. Excellent. Are you ready to move on to the next test?
Yes.
Okay, we're going to be assessing the vagus nerve again. So I want you to just open your mouth and say ah. Okay? I'm going to be looking with a light, and I'm going to be assessing my patient's uvula. So go ahead and say ah. Excellent. What I've come to find by assessing my patient's uvula is that it hangs centered in his pharynx and that there is no deviation to either side. What this tells me is that the vagus nerve is still intact because it's maintaining muscle tone to the uvula on both sides. So I don't believe that there's any vagus nerve damage that has occurred to you at this point, okay?
All right.
Perfect. We're going to be moving on to our 11th spinal nerve. Our 11th cranial nerve. This is known as the spinal accessory nerve. And what I need you to do is I need you just to shrug against my hands, okay? I'm going to place my hands on your shoulder, and you're just going to shrug against them.
Okay.
Ready?
Yeah.
Okay, just give me a good shrug. Oh, one more time. That's pretty good. Excellent. So what we just assessed there is we assessed the equality of your shrug strength, which tells me that your spinal accessory nerve is intact on both sides because I felt very equal shrugging power that you gave me. So it tells me that there's no damage that has occurred to your spinal accessory nerve. So that's good news.
Okay.
Let's move on to the last one, okay?
Okay.
What I just need you to do is I need you to stick your tongue out and just point it down. Perfect. And now relax it. Keep it out and relax it. Let's do a little bit more if you can. All right. We're looking for any deviation to the tongue, which indicates to us any change in muscle tone. If there was any deviation, it would suggest that there's a loss of muscle tone to the opposite side that's deviating away from because it's not maintaining anymore. And now the muscle is being pulled off to the side that's still activated. So we saw that our patient's tongue was equal, and it tells me that there is no damage that has occurred to his hypoglossal nerve. Perfect. Thank you very much. We're going to start planning our treatments and just proceeding with the natural direction of this call. So after assessing our patient's LAM score as well as his cranial nerve assessment, we've decided that there's a few vital signs that would probably be important to get in the field. Firstly would be a blood pressure. We know that patients who consume alcohol regularly, as well as patients who might have a history of hypertension, tend to be more prone to brain injury, such as hemorrhagic strokes. This is because it just weakens a lot of the vasculature inside of the body. And so if there's any injury to the brain, we could potentially see a lesion to one of the main arteries in his brain that could be causing these stroke signs. Another one is going to be a blood glucose level, since we know that hypoglycemia often presents with stroke signs. We're going to be assessing for any tachycardia or cardiac dysrhythmias, which could also indicate some form of stroke or ischemic damage that has occurred to the brain. And then we're probably going to put on an end-tidal CO2 just to capture and assess our patient's respiration rhythm and quality of their breathing. This can kind of give us an idea of how they're further presenting outside the way he's demonstrating right here. Lastly, we're going to go over our working diagnosis, which is obviously a hemorrhagic stroke secondary to a blow to the back of the head that he experienced last night. So we're going to follow down that pathway as our working diagnosis, since this is a life threat. But also we're going to consider a concussion as our secondary diagnosis, simply because our patient was involved in a fight last night where he was hit in the head and now is experiencing occipital pain in the form of a headache, as well as what was the other sign? Shoot. Loss of consciousness. Thank you very much.